During embryological development, if the ventricular septum are not closed completely, it leads to ventricular septal defect. And because of this abnormal communication between the left side of ventricle and right side of ventricle, there is mixing of blood. And it is most common form of congenital heart disease. Now let's take a look at the embryological development of ventricular septum. So the development of this ventricular septum starts from this apex. And it grows like this. It starts from this muscular ridge, and this muscular ridge goes upward to this membranous region, and this membranous region grows downward from this endocardial cushion, and they form two separate chambers. This is normal, but in some people this ventricular septum is not closed completely, leading to ventricular septum defect or VSD. Now, if this defect is due to this membranous region, it is called membranous VSD, which is in 90% of cases. But in some cases, it occurs below the pulmonary valve, leading to infundibular VSD or within this muscular septum. And approximately 50% of small muscular VSD closes spontaneously. And the large defects are usually membranous or infundibular. As the blood comes to the right atrium, it will go to the right ventricle. But now it has two options. Either it will go to the pulmonary artery as usual, or it can go to the left side of ventricle through this window. And we know that the pressure on left side is higher than the right side, and the blood likes to flow from high pressure to low pressure, so it will continue flowing as usual and flows to the pulmonary artery. But when this blood comes to the left side of the heart, it has again two options. Either it can continue flowing to the aorta or can go to the right side of ventricle. And as the blood pressure is lower on the right side, so this blood will flow to this lower pressure side. If this continues for a long time, then the pressure on right side will start increasing, leading to pulmonary hypertension. And because of this, there will be now reversal of shunt. That means the blood will now start flowing from the right ventricle to the left ventricle, because now the blood pressure on the left side of heart is comparatively low. And when this happens, it becomes cyanotic. And this situation, when there is reversal of shunt, it is called Eisenmenger syndrome. Now, VSD can be isolated alone or can be associated with Down syndrome or with tetralogy of Fallot. Now, how can we test it? So for that, we can do auscultation and we can hear some murmurs. And for the treatment, we can do surgery. Thanks for watching. Don't forget to like and subscribe and share with your friends.